Hi everyone, thanks again for tuning in. I hope you've been enjoying all of our videos so far. Please don't forget to comment in the comment section below. Let us know, what kind of videos you'd like us to do in the future and what other topics you'd like us to discuss. Today I've got a really special guest with us. His name is Dr Nawaf Yassi, and he will be joining Dr Rachel Buckley and I as lead investigators of the Healthy Brain Project. So I hope that you join me in welcoming him to our study. Welcome.
Thank you, Ian. Thank you.
And thank you for being a part of our initiative. Just to start, can you tell us a little bit about yourself?
Okay, so my name is Nawaf Yassi. I'm a neurologist at the Royal Melbourne Hospital, and I mainly specialise in stroke. So during my work, I see a lot of patients with acute stroke, and at the Royal Melbourne Hospital, we treat every year about 800 to 1,000 patients.
Wow.
With stroke, and they're patients that come from all over Melbourne and also all over Victoria.
That's incredible.
We treat a large proportion also of younger people who have stroke, and as well as older people, and we're involved with all the treatments from right when the patient presents all the way until they're discharged to home or to rehabilitation and follow up.
Wow, that's a huge undertaking. Thank you very much for joining our study. We feel really, really privileged to have you be a part of it.
It's a pleasure to be involved.
So I guess, you do a lot of work in stroke, it sounds like. What is your, what do you think is the link between stroke and dementia? How did you become a dementia researcher?
Yeah, so one of the things I'm most interested in is that overlap between stroke and dementia. And we know that there is a lot of overlap because both conditions are diseases that are, for example, associated with aging. Both conditions have very similar risk factors. A lot of the risk factors for Alzheimer's disease, for example, are very similar to the risk factors for stroke.
Okay.
We also know that about 30% of people who've had a stroke will go on to develop what we call post-stroke dementia or post-stroke cognitive impairment.
Wow.
But not only that, there's also what we accept as a sort of a subclinical or a silent burden of stroke that we don't actually see in the hospital, because we know that a proportion of people who are living in the community fairly healthy do have on their brain scans what we call silent brain infarcts, which are essentially the same as a stroke that just hasn't caused symptoms because perhaps it's a smaller lesion, or because it is in part of the brain that hasn't caused weakness down one side, for example. And we know that about 7% of people who are between 30 and 50 will have one of those brain infarcts.
Wow.
And that goes up to...
kind of scary.
Yeah, and it goes up to about 15% in people that are over 70.
Yeah.
We do also know from large studies that having one of those silent brain infarcts doubles the risk of developing dementia compared to people who don't have one of those lesions.
Wow, that's huge.
Yeah, absolutely. So there's clearly an overlap between the two conditions, and that's something that's very important to try to understand better.
Yes, definitely. And you mentioned earlier that the risk factors for stroke are very similar to the risk factors to dementia, and so I'm guessing they're things like diabetes and hypertension and things like that.
Absolutely.
So are there preventative measures that people can take?
Yeah, absolutely. So stroke is preventable, and there's not only sort of medication-based preventions, but also, very importantly, lifestyle-based preventions. So we know that some of the most important risk factors for stroke are based on lifestyle. So these are things like exercise, diet, so avoiding things that are highly processed, high in sugar, high in salt, high in fat, not smoking cigarettes, moderating alcohol intake. These are all things that people can do to reduce their risk of stroke, and they also have additional benefits in terms of overall health, reducing the risk of heart attack, reducing lung disease, arthritis, etc., etc.
So it's really what's good for the heart is good for the brain.
Absolutely.
That kind of link, that message.
So some of the other conditions that you mentioned, like diabetes, hypertension, high cholesterol, we really encourage people, particularly if they've got a family history of one of those conditions, to be monitored very closely by their GP and to be treated very actively through their GP if any of those conditions are detected, and that can also reduce the risk of stroke.
Great, excellent. What are the warning signs for stroke?
So stroke is a sudden condition. It happens very suddenly, often without any obvious warning. But the most important thing is to recognise the symptoms of a stroke very quickly, because we now have a lot of very effective treatments available to us if people can get into the hospital very quickly.
Okay.
So the signs of a stroke, to remember the signs, we use the acronym FAST, F-A-S-T.
That's an easy one to remember.
Exactly. So it's F for face. So patients with a stroke often have a droopy face on one side.
Okay.
A for arm, meaning that if you ask them to put their hands up like this, one of the arms will drift down. S for speech, meaning that their speech will be very slurred or indiscernible or won't make sense. And T is for time, meaning that the most important thing, if you do recognise symptoms of a stroke in a friend or a family member, is to call 000 immediately and get them to the ambulance. We do know that in a stroke that's caused by a blocked artery, about 2 million brain cells are lost every minute. So there is really that urgency to get people into hospital to have treatment.
Yeah, definitely. That's quite a number.
Absolutely.
Yeah. Excellent. Thank you so much for joining us today, and thank you so much for all that information. That I think everyone will agree that was very, very helpful, really useful information to know. And I hope that wraps up our video for today. Thank you very much for joining us. If you have any questions, please remember to email us at healthybrainproject@florey.edu.au, and we'll try and get back to you as quickly as we can.
Thank you, Yen.
Thanks.